Hi, and happy Pharmacy Week. My name is Anna Brittingham, and I'm a pharmacist here at the Inpatient Pharmacy at Atlanta General Hospital. And I just wanted to go around our inpatient pharmacy during Pharmacy Week and ask everybody what they do throughout the day so that you get a glimpse into what it's like in the pharmacy. And here we have James McGinnis, our Director of Pharmacy. James, tell us what you do throughout the day.
Throughout the day, my day would probably begin with a huddle to talk about the status of all of the patients and systems in the hospital. I typically report on pharmacy and pharmacy's readiness. And then throughout the day, I may be either in the inpatient setting or at the cancer center, working with the pharmacists, asking questions, finding out if all of their kind of needs are being met so that we can remain productive. Part of also my daily task is to look at cost and pricing and generate reports. And then perhaps the fun part is coming over and talking with the staff and finding out what they need. So that's kind of what my typical day might be. A lot of meetings, a lot of reporting, hopefully providing some level of support to the staff, interacting with the medical staff, and trying to meet all of their needs. So that's my typical day.
Thank you, James. And here we have Anna Oberste, our clinical pharmacist. Anna, tell us what you do throughout the day.
Hello, everyone. So I start my day off by looking at every chart in the hospital, and I look for anything I can help our patients. Then I go to clinical rounds at 11 for our complex cases in the ICU. After that, I usually come back and document my changes and start doing reports, because hospitals monitor how well we're taking care of our patients. And then go to meetings, a lot of meetings, so that we can educate our staff and stay on top of the most recent guidelines and create order sets that are helpful to everyone out there. And that's what we do.
Thank you. And here we have Michael Giesemann, our operations supervisor. Mike, what do you do every day?
Well, every day I come in, help with staffing, make sure all of the techs and pharmacists are good for the day, don't need any support. I help with scheduling, maintain Board of Pharmacy regulatory compliance and Joint Commission compliance.
Thank you, Mike. And here we have Jackie, our medication reconciliation technician. Jackie, tell us what you do today.
Okay, throughout the day, I come in at 6 a.m. I come in and I gather the patient's information for medications that they're on at home, and I input what they tell me in the computer or from the pharmacy, and then I print out the paperwork so the pharmacist and the doctor can get the correct medications in the system.
Thank you, Jackie.
You're welcome.
And here we have David, one of our pharmacy technicians. He's in the day shift IV technician role. And David, what do you do in this role?
So every day we are here preparing all of the intravenous medication for the patients, both upstairs that have been admitted and downstairs in our emergency department. So we're filling all of the daily orders for the carts, and we're also filling different IV medications for the Pyxis machines, like this Tepra bag. And we're also making on-demand orders back in our clean room for doctors that order on-demand orders. So that's really mostly it, I guess.
Thank you. And here we have Josh Green, one of our night shift pharmacists. Josh, what do you do every day?
Hey everybody, happy Pharmacy Week. I'm Josh. I'm the operations pharmacist here in the evenings. I've been here full time for about 2 years, and my job responsibilities pretty much include verifying orders, talking to other clinicians, managing the evening techs, filling the Pyxis, going over compounded sterile products, and sending out all patient medications throughout the evening.
Thank you. And here we have Shannon, our opener pharmacy technician. Shannon, what do you do during the day?
Well, when I come in here at 5 in the morning, I start pulling my Pyxis replenishments and I deliver them to the Pyxis machines out on the floor. And then later in the day, I start getting patients' medications ready and I put them in the bag and send them out with our carts, or if they need them spat, I take them to the patient's bins And then later on the day, I do another Pyxis replenishment, and I get that all ready. And then I'm basically almost done for the day.
Thank you, Shannon.
You're welcome.
And here we have Kelly Klein, MPHA Pharmacy Technician of the Year. Kelly, awesome. You're great. What do you do for us every day?
So every day, I place the orders, but I look at each individual item, make sure it's the best price, comes in the form that we need. So I spend a lot of time doing that to save money. I also manage the Pyxis logistics inventory system in here, as well as RFID tagging.
Thank you, Kelly. And you're great. Don't forget it. And here we have Mike again, and he's covering the day shift pharmacist today. Mike, what do you do here in this position?
So as the day shift pharmacist, we verify orders for patients that come through for new orders. We deal with narcotic, both receiving and dispensing to the Pyxis devices, and we check cart fill and IVs that go out the door for patients on a day-to-day basis.
Thank you.
Hi, I have Anna Brittingham here, a mid-shift pharmacist. And I'm going to ask Anna, what do you do on a daily basis?
Thank you. Yes, throughout the day, I do multiple things. So first I get here and I work up the patients clinically, evaluating medications and opportunities for improvement on their regimen. Also answering questions for any of the physicians, and really supporting the day shift staff pharmacist that's here to verify meds and dispense the meds so that all the patients are provided care appropriately. I also help the night shift pharmacist because I work an 8 to 6 shift. So I get a little bit of day shift and night shift in my schedule, which is nice. And then I get to also work at the Regional Cancer Care Center, helping our pharmacists over there work up patients that get infusions, whether it's chemotherapy or iron infusions.
I have an additional question for you.
Mm-hmm.
Are you the leader of the Pharmacy Week initiative this year?
Yes, sir. I did, with James' help, lead Pharmacy Week this year. And hopefully this is the best Pharmacy Week yet.
And so far, it looks like it's going to be an incredible Pharmacy Week, October 16th through the 20th. And AJ, thank you so much. We greatly appreciate it.